Nasogastric insertion is the insertion of a nasogastric tube into the stomach through the nose. The purpose for this procedure is to assist patients in feeding. There are some patients who cannot take food through the mouth, and this could be due to probably swelling parotid glands, tonsils, and sometimes it could be due to cancer of the esophagus or cancer of the mouth. So some of these conditions would warrant a patient to feed through a tube, and some other conditions could be maybe due to an accident. The patient was involved in a fatal accident that they cannot be able to feed food for themselves through the mouth. For example, they had a broken jaw in a road traffic accident, so that might necessitate the insertion of a nasogastric tube. Now, nasogastric tubes come in sizes depending on the age of the child, the person that you want to insert. For the children, they come in very smaller size, and for adults, they come in bigger sizes. So with me here, this is a trolley that we have for NGT insertion, and then we'll walk you through on how the procedure should be done procedurally. Now, down there is a tray. The tray contains solutions. That's water, spirit. You have also some nasogastric tube in a plastic, and then we have some syringe, and we also have KY jelly. KY jelly is simply a solution that we use to lubricate the nasogastric tube. On top, we have the receiver for putting dirty things. We have a gallipot for putting the nasogastric tube on, and then we have these gallipots housing cotton wool, cotton gauze. Then we have an empty gallipot where we put our solutions. Hopefully you are able to interpret and understand it. We also have a forceps that will be used for clamping the nasogastric tube when we begin to insert. Are we there?
Yes.
Okay, thank you so much. Now we begin our procedure, and as usual, before starting any procedure, it's incumbent for us that we clean our hands, or we wash our hands. So we are going to make ourselves clean. So, okay, good morning, sir. Yeah, my name is Mark, and I'm here to come and insert a tube so that it can assist you to be feeding. Now with this, I've not yet prepared, but immediately I'm done, I'll be coming. Could there be anything that you would love me to do before I come to insert the tube? Okay, thank you so much. Now I would want to see and check where you are sleeping. If you are comfortable, a little bit comfortable. Okay, everything seems to be okay. I want to stretch the linen a bit to cover you. All right. If you could allow me, I would leave some clothes on top of you. This is a towel. This will just assist us in preventing linen from getting soiled. So I'll leave it on your laps. Never mind, it will not be very heavy. Okay, thank you. All right, thank you so much, sir. When I come back, I'll be coming with an assistant, so please don't mind. You'll just be there to follow what I'll be telling you to do. Okay, thank you so much. So, you are done. once you are done with that, take care of your hands nicely. This is water. In this procedure, you may need a litmus paper as well. Very, very important. That would help us to know whether we are in the stomach or we are in the lungs. Because you know the trachea and the esophagus, they are almost adjacent to each other. This is KY jelly. I just put it just by the edge of the gun pot. Okay. Alright, when that is done, clean my hands nicely like that. Get my glass. Then put them on. These are not sterile glass. But when you're doing this procedure, you need high-level glass. You need high-level glass, those that are thicker than this, just to assist you in doing the procedure. Okay, sir, I have prepared, and I'm here. I'm going to ask somebody to come and help me put you in an upright position. Mr. Light, you can come and assist me. Lift him and put him in an upright position. Okay. Let him just sit. Let him sit. Okay, thank you, sir. Just support him. Support him for me. Okay. So, I'm going to put this on you. It will not be heavy for you. Okay. So that's a ball. The ball plays an important role in case the patient vomits when we are inserting the tube. Okay. So, from that, I'm going to prepare the solution. Okay, so clean the nose. Clean the nose nicely. Why you are cleaning the nose is to make sure that the patient is comfortable. So I'm going to do the measurements from the ear, the earlobe. The earlobe is here. Okay, and then up to the tip of the nose. And then from the tip of the nose. Oh, sorry. Never mind. From the tip of the nose to the earlobe. Are we observing? Mm-hmm. From the tip of the nose to the earlobe. And then it comes down there, up to the xiphoid there. Okay. So where it ends, I'm going to put a strapping, or if not a strapping, I'm just going to clamp it there so that I'm not confused. Please, I'll repeat this. We're starting the tip to the tip, like that. Then it goes like that. And then let it come down there on the xiphoid sternum. Okay, or xiphoid process. And then from there, I would clamp it. Okay. So that I don't forget, this is where it should end. In short, it should give me at least 56 centimeters, 56 to 66 centimeters. Inserting it inside there. Okay, so from there, remember we have put some KY jelly here. So apply enough of this KY jelly here. Okay. Okay. So, sir, If it's possible, you could assist me to lift the ball. But if it's not possible, then I'll ask Mr. Life to help me carry the ball. Thank you so much. And then, as he carries the ball, I'm simply going to ask Mr. Chironda to fold his head, okay? To face downward like that, okay? This is to open up the esophagus, the larynx a bit, okay? So, again, you can push up the head, down the head, okay? Nicely. So, after doing that, I begin to push. Okay. So, I'll be asking to be swallowing. Okay. So, you keep on swallowing as I'm inserting. Okay. Keep on swallowing. Keep on swallowing, sir. It's important. Keep on swallowing. Keep on swallowing, sir. Keep on swallowing. Do it gently. Don't force the patient because you may end up causing what is known as brain damage there, brain herniation. Okay. So you push nicely, or if not so, you end up injuring the patient. Push until it goes up to where the clamp is, okay? So we've pushed and the clamp has reached there. You've seen, eh?
Yes.
Okay, now, after the clamp has reached there, we've seen where the clamp is, we are going to simply unclamp like that. Are we together?
Yes.
Then when we unclamp, we are going to get a syringe, and then we are going to insert it there, and then we are going to aspirate. When we aspirate, you see the stomach content is coming, and then it comes into the syringe, isn't it? The color of the stomach, I mean the content will tell you whether you are in the stomach or you've gone into the lungs. Usually in the stomach content will look whitish, okay? And sometimes it might look greenish, okay? Okay, yes. And then when you go into the lungs, it might be serous or it will look very clear. So the purpose of this, we remove this stomach content like that. After removing it, we clamp there, we close, so that we do not allow air to do what? To go in. So once we do that, we are going to put this stomach content into a receiver, okay? We flush it into a receiver. After flushing it into a receiver, we are going to get a litmus paper and drop it in there to check the acidity. The stomach is acidic, okay? So if it's acidic, it's going to turn this blue litmus paper into red, okay? If we are in the stomach, the litmus paper is going to turn from blue to red. But if we are in the lungs, the litmus paper will remain blue. Okay? Mind that test. And then after we've done that, we are going now to do a verification test. We are going to open there. And then we are going to get clear liquid. And then we'll dip it into where? Into the water there. So when we are in the lungs, you will realize that bubbles will begin to do what? To come out because the patient is breathing. So you see, so when you don't see bubbles, then you are sure that you are not in the lungs. So what you do, you clamp like that. After clamping, you push this thing back, and then you close with a spigot like that. And then after closing with a spigot like that, you relieve the person, put those things down, get strapping, and then strap it, okay? Strap it by the edge there, okay? Or not, you can strap it here, whichever the edge, so that it's attached, it does not come out. Remember, there is no bulb inside that I'm going to inflate so that it remains in situ. So there's need for us to put strapping there. So after putting some strapping, Mr. Chironda, how do you feel? You feel better? Okay. It might irritate you for some time, but this will help you to be alive. Okay? I will now put you into a sleeping position. Is it fine? Okay, thank you so much. So we'll put him into its usual position. Remove your items there that you have put. Fold. Then push it down. Sir, thank you so much for your cooperation. Hopefully, you'll be able to now be relieved of the pain that you used to feel when you feed using the normal mouth. Thank you so much. The procedure is done. Okay, do you have any questions with that?